Hey, welcome back once again. Dr. McPhail from McPhail Chiropractic in Summerville is here to talk about carpal tunnel syndrome. And a lot of people seem to be getting this, especially since the onset of more computers at work, more computers at home, and texting and doing all this kind of stuff. Tell us, what are the symptoms of carpal tunnel syndrome?
Carpal tunnel symptoms, you're going to experience some numbness or tingling in the hands, sometimes shooting pain or radiating pain. A lot of repetitive syndromes of sitting at a desk at a computer can exacerbate this. And what we find in our clinic is a lot of patients will come in and say, hey, I have carpal tunnel syndrome, or they've been diagnosed with carpal tunnel syndrome, and there's some other factors involved that kind of lead to a different problem. It's not so much a carpal tunnel type syndrome. The carpal tunnel basically goes through the median nerve, which has distribution that goes to your thumb, index finger, middle finger, and half of your ring finger.
Okay.
So the patients will come in and they'll say, I'm having numbness in these areas. A lot of the patients will come in and say that they're having numbness in their pinky finger as well.
Okay.
And that's the ulnar nerve, and it doesn't even go through the carpal tunnel.
Okay.
All right. So
there's something else going on then.
Yeah, there's something else going on, and a lot of the time, due to the repetitive stresses of sitting at a desk at a computer, it puts a lot of abnormal stress on the lower cervical spine. And what happens is the discs will begin to degenerate, causing degenerative disc disease. And when it does that, it puts compression on the nerves. Now, the C5, 6, and 7 nerve roots, the ones that exit your neck right here, they're the ones that supply strength and energy down through your shoulders, arms, wrists, hands, and fingers. So when you have a problem in your neck, it can present with symptoms similar to carpal tunnel, but there's some other things to look for.
So a lot of times when that is occurring, you go directly to the source of what is causing that end result down here.
That's right. That's right. We're able to address the degeneration of the cervical spine. If it's something going on with the elbow, we can address that as well. Some of the common things that we like to get the information out there is if it's on both your hands. Okay, if you're experiencing the symptoms in both your hands more often than not, you're going to have something going on in the neck. Okay, because with carpal tunnel, it tends to be unilateral. You're right-handed for the most part, or left-handed. You're going to have more stress on that side.
Usually your predominant hand.
Right.
Okay.
Right. So if you're experiencing the symptoms in both hands, there's a good chance it's not a true carpal tunnel syndrome. A couple other things is if the symptoms are bilateral and they're about the same, they're equal. Like if you have the same amount of numbness in your right hand as you do in your left hand, there's a good chance it's more of a cervical spine problem.
And again, a lot of times that has to do with how erect or how proper the person is sitting in the chair, what type of chair they have, the altitude or how high or low their desk is, and how high or low their chair is as well. And it should be at a certain fit where your legs are 90 degrees and that sort of thing, but you don't need to be craning or leaning forward. That'll put pressure on your neck.
That's one of the most common postural distortions we see is what's called a forward head syndrome, where the head comes forward like this. And what happens is, as you start to lose that normal weight-bearing relationship, gravity takes over. And over time, you end up being that little person at the grocery store shuffling along because because of that repetitive stress.
All right, very good. Just a couple more seconds. What about high cholesterol? Does that have anything to do with it?
Okay. Diabetes, high cholesterol, some other things you want to look at when you have numbness in the hands, tingling. It could be a peripheral neuropathy. The reason with cholesterol, a lot of statin drugs that are designed for lowering cholesterol, some of their symptoms or side effects can be peripheral neuropathy, which can cause numbness and tingling. So that's something you want to rule out as well. And if you're a diabetic, neuropathy can also go into the upper extremities and cause that numbness and tingling as well.
Dr. McPhail, thanks for that great information. Stay with us. We've got more coming up in just a moment with Low Country Live. McPhail Chiropractic, 873-2225.